It was nearly 20 years ago Ghana recorded its first HIV/AIDS case. The head of the National AIDS Program Secretariat, Dr. Shanti Singh, says the response then was not coordinated, especially care and treatment. And it was in 1992 Ghana's national HIV/AIDS response was coordinated.
And by medical response, it means basically looking at persons who are already diagnosed HIV positive and that were coming into the healthcare system seeking care and treatment. And so in 1992, when we were established, it was primarily to do so. But I think, like everyone else, we have recognized over the years that the role of the Secretariat cannot be limited just to treatment and care. And so over time, the functions and the role or the mandate of the Secretariat has been expanded really to include a larger gamut of activities and functions that will cover not just treatment and care, but also include things like advocacy, prevention, surveillance, and really make the response a comprehensive response.
Ghana has a population of approximately 750,000 people, with about 13,000 people living with the disease.
That when we started at the GUM clinic, offering antiretrovirals to persons living with HIV, we started in April of 2002. That before we started, there was a baseline survey that was done, and what we found is that people who showed up at the GUM clinic, most of them showed up with full-blown AIDS, more or less. They were put on ARVs nevertheless, but people who showed up at that point of time, their average survival rate was about 5.6 months. And we're talking about months here. When we conducted the UNGAS report of 2005, I believe, last one was 2007, 2005, we did a study to see, well, one of the indicators that we had to respond to was what percentage of your people were still alive after 12 months of being on antiretrovirals. And what we found was that over 80% of our people were still alive after 12 months of being on ARVs. And so the better the treatment and care program gets, the longer people will live. And the longer people live, then that pool will increase. Hopefully, on the other end, if you have a good enough program, which we're working towards in improving and in strengthening the prevention program, then the number of new infections that are occurring on a yearly basis will keep on reducing, and so that's where it balances off.
Today, the Secretariat has several programs aimed at creating HIV/AIDS awareness and prevention. One of such is the Secretariat's Prevention of Mother-to-Child Transmission of HIV and AIDS, which targets pregnant mothers.
We have seen over time, if you look at 2002, for example, that in doing our antenatal survey, that the prevalence among that population was about 5.6%. And when we repeated that same survey in 2004, the prevalence was 2.6%. And when we further repeated that survey last year, in 2006, the prevalence was about 1.55%. And so if you plot that on a chart, and even without plotting it, you can be able to see the impact that we're having in the PMTCT program.
Dr. Singh says pregnant women who have tested positive for the disease are enrolled in the program.
And so once you're diagnosed HIV positive, the appropriate counseling is given, the appropriate management takes place at the time of delivery and postpartum after delivery, and the baby is managed appropriately.
The NAPS director says the program's successes are quite visible.
Babies that are born, we call them exposed babies, babies that are born to mothers who are HIV positive. Before November of last year, we tested those babies at the age of 18 months because we did not have DNA PCR accessible to us at that time. And so it was only at 18 months of age, when we did the rapid testing, that we saw what was the status of the baby, or we were able to say very confidently or to confirm the HIV status of this baby. From around November of last year, we had access to DNA PCR, whereby at the age of 6 weeks, we were able to say, yes, definitely this baby is HIV positive or this baby is HIV negative. And if the baby is HIV negative, then importantly is that we continue to work with the mother and continue to work with the infant, because there is the possible risk of transmission through breastfeeding, and so we have to continue that counseling and so on. And what we have found since November, if we look between November and December, I can't remember exactly the number, but over 20 babies were tested using DNA PCR testing. And the mother would have received that full course of PMTCT intervention, and for those babies, not one came back HIV positive.
Guyana is one of the countries most affected by HIV/AIDS in the Caribbean, with an HIV prevalence rate estimated between 2 to 3% among pregnant women. In 2001, the government of Guyana, recognizing this problem, responded by setting up a pilot prevention of mother-to-child transmission project in 2 of the regions with the greatest burden of HIV infection. Prevention of mother-to-child transmission interventions are now fully integrated into the maternal and child program and are thus fully linked with safe motherhood initiatives implemented by the Ministry of Health.
Encouraging each and every one of you stop discriminating against people living with HIV. We all understand it's a serious disease, and people living with HIV has feelings too. Show your support, your love, show them that you care, help them to live longer. That's what we're talking about. Boom.
HIV/AIDS is a human disease and will be around for a long time. People living with the virus need our love and support. Quite often, we're faster spreading news of someone being infected rather than participating in the Live Up campaign message of love, protect, and respect our friends, colleagues, and relatives. Let us embrace people with the disease. Let us encourage people to get tested, and let us always remember to live up and to protect ourselves always.